So it's about 7 p.m. this evening, and in the children emergency ward in one of the hospitals here in Nigeria, and some set of people rush in an 18-month child, and it's sad to know that this child was brought in dead. And what's the history? This baby took in a poison. He took in bleach, and that was the beginning of his problems. And in 2 hours, this boy was gone. He was dead. Why? That's why I'm doing this video, to educate you on what you need to do when children ingest poison. What you should do to prevent death in these children. Now, what are childhood poisons? Oh, poison. This poison is not that one you watch in African Magic in films. No. Those poisons, it could be drugs, medications that you take in, household cleaning agents like bleach, hypo. Also, common poisons include kerosene, fuel, diesel, and for some reasons, children just ingest it. They take it in, unknowing to them that these things are poisonous. And it's common amongst children. You know why? Because they are active, they're always playing, and it's common between children aged 1 to 4 years. And they want to explore, they want to do this, taste this. Their mouth is just looking for what to take in. And a few times, they take in those poisons. This reminds me of a colleague's friend who took in one of the tablets the grandmom was taking for sleep, and this baby slept for hours. I've also heard of cases of children taking in kerosene. The beautiful thing about kerosene is that it has a very pungent taste. It's not nice, it's not sweet, so they don't take in much sometimes. But in hypo, bleach, they take in sometimes so much. And you and I can do some things to prevent these children from ingesting these poisons that can shorten their lifespan. Now, if for any reason they ingest these poisons, these substances, 2 things you must not do. Number 1, do not force them to vomit. Do not force them to vomit. Here is why. If you force them to vomit, they are at risk of coming down with what we call aspiration. They can aspirate. I'll explain. What is aspiration? You're forcing them to vomit. That substance they have taken, especially kerosene or bleach, can go into the lungs, because there's a close relationship between the throats and the lungs where you breathe. There's a close relationship. So when you force them to vomit, as some of those substances come out, sometimes those substances that come out can now enter the lungs, and that kills them in minutes, in fact in seconds. So number 1, do not force them to vomit, what we call induced emesis. No, do not. Number 2, mothers, do not force them to take oils, from olive oil to coconut to palm oil and the rest. You may think you're treating it, but it may worsen their condition. We've talked about what you should not do. So what do you do? Immediately that occurs, at that time, there are so many teachers around you. Please leave them alone. Take that child to the nearest hospital. preferably a teaching hospital where there is a presence of the pediatrician. The pediatrician is the children doctor, because that, for me, that patient, that baby needs a specialist care. So do not do anything. The child has taken that poison. Just pick the child, leave all the several teachers you have around you, and take the person to the nearest teaching hospital. When you get there, there are some things they will do for you. They may tell your child not to eat what we call NPO. There is a reason. They may give some one or two other medications like omeprazole and the rest. You're now in the hands of the specialists, and you allow them to do their work. Above all, the common saying that prevention is better than what? Cure, right? It's actually cheaper too. So if there's anything we must do to reduce the occurrence of our children taking in poisons, is that we must store these things away from them, out of reach. Out of reach. Your medications, ensure that the children, their hand cannot reach it. All these household cleaning agents, liquid soap, hypo, bleach, kerosene, diesel, we put them in places where children, their hand cannot reach. I agree they can be adventurous and they can still get to that place, but do the one you can do. Let it be out of reach of those children, because if it's out of reach, then they would not be able to ingest it, and all the problems that come with it will be far away from those people. I hope you've been able to learn some things. If this video interests you, please like, share, and subscribe to my YouTube channel. If you want more of such content, please type in the comment section. I promise to do a video to answer those questions. Until I see you again, my name is Dr. Ale. Please keep winning. Bye.